Hi friends, welcome to Kavi's World. Today's topic is related to drug calculation essentials for nurses who prepare for CBT and other competitive examinations. This is one of the most requested videos from my students and my friends. One of the most important and critical questions in most of the competitive examinations including CBT is drug calculation. Not only for examinations, but also in our daily nursing practice, accurate drug calculation knowledge is important to avoid error. Before starting, I would like to request you to have a pen or a pencil, a notebook or a piece of paper, and your concentration for effective learning. Metric conversion is one of the basic knowledge which is essential for accurate drug calculation. So here are some metric weights arranged in size order, starting with the biggest. It's kilogram, and then comes gram, milligram and microgram. Each one is 1000 times smaller than the one before. The same rule applies for metric volumes below, liter and milliliter. This is a simplified diagram which will give you an idea regarding how it works. If you want to convert from kilogram to gram, you have to multiply by 1000. And if you want to convert from gram to milligram and milligram to microgram, also you have to do the same. Vice versa, if you want to convert microgram to milligram, or from milligram to gram, or from gram to kilogram, you have to divide by 1000. If you want to convert from big to small, you multiply by 1000 by moving the decimal point 3 places to the right. Next, we can go through some of the examples of metric conversion. So I need you to take your pen and your paper and write down your answers, and finally we can see what's the correct answer. So first question is convert 7.5 kilogram to gram. So already you know what you have to do. Second one is convert 7280 microgram to milligram. Convert 1.5 liters to milliliter. Fourth question is convert 55 ml to liter. So the answer 1 is 7500 gram. The answer for the second question is 7.28 milligram. Answer for third question is 1500 milliliter. Answer for the fourth question is 0.055 liters. So for the drug calculations, the main thing we have to know is universal formula. This is applied for most of the calculations of the nursing drug calculation. So the universal formula is D by H into V equal to dose. D is desired amount, that means what doctor is prescribing for the patient. H is dose on hand, that means what is written in the label. And volume is what is the volume of the medicine. If it's a tablet, it will be definitely 1. If it is a syrup, it will be mentioned. For example, 250 milligram per 5 ml. So the volume will be 5. If it's an injection, what amount we are using to dilute the medication, or it will be given like 2 milligram per 1 ml or 2 ml. So that's the volume. Next slide is regarding giving the correct amount of tablets. Here also we have to apply the universal formula, and we can see an example. Your patient has been prescribed 400 mg of ibuprofen. The tablet available is 200 mg. How many tablets do you give to the patient? It's simple. So the dose prescribed is 400 mg, and the tablet what we have is 200 milligram. So first we have to see whether the units are same. If the units are different, we have to make it same, and the answer is 2 tablets. So next is some of the practice questions. So when I am reading, you can pause the video and you can calculate and write it in your piece of paper or book, and then you can calculate it later. You can see the answer later. So the first question is, a patient has been prescribed 40 milligram. The stock tablet you have are 20 milligram. How many tablets do you give to the patient? Apply the universal formula and see whether the units are same. A patient has been prescribed 0.06 milligram and the stock tablets you have are 30 microgram. How many tablets do you give to the patient? So you can see like the units are different. So you have to see which one you have to convert. So if it's me, I would convert milligram to microgram because it's more easier. So the third question is, the stock tablet you have are 600 microgram and a patient has been prescribed 1.2 milligram. How many tablets do you give to the patient? Here also the units are different. So when you are calculating, just concentrate on converting one to the same units. So if it's me, I would prefer to convert 1.2 milligram to microgram. Fourth question is, a patient has been prescribed 750 milligram total daily dose of tedious means 3 times a day. The stock tablet you have is 250 milligram. So how many tablets you give to the patient a day? So always read the questions correctly. Sometimes they will ask how many tablets you give to a patient a dose or a day. So always underline the main points in the question when you are seeing the question. So next one is, fifth question is, a patient has been prescribed 200 milligram every 4 hours. The stock tablets you have are 100 milligram. How many tablets you give to the patient a day? So here the patient needs a dose every 4 hours. That means in 24 hours the patient needs 6 doses. 24 divided by 4 hours. So 6 doses a patient is getting. So 6 into 200 is 1200 milligram. And you have to apply this in the universal formula and you will get the answer. So now we can see the answers. Check whether you got all the answers right. So the first question answer is 2 tablets. Second question's answer is 2 tablet. Third question also 2 tablets. Fourth question answer is 3 tablets. And the fifth question answer is 12 tablets. If you have any doubt, you can comment in the comment box or I will give the details in the description box. So again the universal formula is D by H into V equal to dose. Desired amount divided by dose on hand into volume equal to dose. Next we are going to see the correct formula for giving the correct amount of injections. So for this also you have to remember the universal formula again. And whenever you are calculating the dosage in the unit or for examinations, look for the units, write down the value quickly once again and substitute in the formula. We can see an example. Your patient has been prescribed 50 milligram of pethidine as injection. The stock strength available is 100 milligram in 1 ml. How many ml do you give to the patient? This is a simple question. So the dose which is prescribed is 50 milligram divided by the stock strength is 100 milligram into the volume is 1 ml. So the dose we have to give via injection is 0.5 ml. You can see some questions. So same you have to do it with your pen and paper and we can check the answers whether it's correct or not. So the first question is, a patient has been prescribed 2 milligram of pethidine. The stock strength you have is 10 milligram per 1 ml. How many ml you give to the patient? So it's the same as the example. Second question is, 40 units of insulin is prescribed for a patient. It is dispensed as 100 units in 1 ml. So how much do you give? So it's like, what's the prescribed dose? It's 40. So 40 divided by The dispensed amount is 100. So 100 into 1. Third question is ampules of morphine contains 10 mg in 2 ml. So that is the stock dose. What volume must be drawn up to give 8 mg? So 8 is the prescribed dose. Fourth question is the patient needs 250 microgram of drug X. You have 1 milligram in 1 ml. So how many ml do you give? So you have to see whether the units are same. If it's not same, you have to convert, then apply in the universal formula. So now we can see the answers. So for the first question, the answer is 0.2 ml. Second question, the answer is 0.4 ml. Third question, the answer is 1.6 ml. And for the fourth question, the answer is 0.25 ml. Next we can see regarding body weight calculations. It's simple. So if body weight calculations mainly comes when the dose is prescribed in milligram per kilogram per dose. That means this many milligram is needed for this many kilograms of weight. So the dose required equal to prescribed dose into body weight. The formula is simple and easy. Apply to universal formula if needs to know the dose to be given. So we can see an example. Mrs. B is prescribed ibuprofen 5 mg per kilogram per dose. That means 5 mg is needed per kilogram. She weighs 50 kilograms. So 50 into 5 will be the dose to be given. So 50 into 5 equal to 250 milligram. And if the question continues like this is the prescribed dose and this is the dose which is in stock, you can use the universal formula. So we can see a practice question for body weight calculation. A patient who is 5-year-old and weighs 20 kg has been prescribed 5 microgram per kilogram body weight of digoxin elixir. That's a syrup. And the preparation is available in 50 microgram per ml. So the unit is same. How much microgram does the patient require for a single dose? And what volume will you give to the patient at each dose? So the answer is 20 kilogram into 5 microgram is 100 microgram. And the volume is, we apply the values in the universal formula and the answer is 2 ml. So next we are going to see regarding the infusion rate calculations, and among them we are going to see ml per hour first. So ml is volume and hour is time. So we can see an example, so it will be easy for you to understand. A patient is to receive 4 liters of normal saline over 8 hours, and what is the infusion rate in ml per hour? So always think in mind, ml is volume and hour is time. So ml per hour means volume in milliliter divided by time in hour. So first of all, we have to convert 4 liters to milliliter, that is 4000 milliliter, and time is already given in hours. So 4000 divided by 8 equal to 2000 divided by 4 equal to 1000 divided by 2 equal to 500 ml per hour. Next we can see the basics of IV fluid administration. In that, if we want to calculate the drops per minute, we have a formula. It is amount of fluid in milliliter divided by total time of infusion in minutes into administration set drop factor. Drop factor will be usually given in the question itself. So we can see an example. A patient is to receive 1 liter of normal saline over the next 4 hours. What is the infusion rate in drops per minute if the drop factor is 15? So the answer is, first of all, we have to convert 1 liter to ml, which is 1000 ml. Then convert 4 hours to minutes, that is 4 into 60. And substitute in formula and we will get 62.5. And we have to round up or round down according to the answer we are getting. So here 62.5 means 63 drops per minute. Now we can see how we are going to round up and round down. So for rounding, we have to find our number, like look right next door. 4 or less means just ignore. For example, it's 5.4 means you have to write 5. But 5 or more, add 1 more. If it's 5.5, write 6. So now we can see regarding if there is changes in the questions. For example, ml per hour is given, and if they want to calculate time, you can use the same formula, but you have to use the principles of mathematics. That is, rate in ml per hour equal to volume by time in hour. So if you want to calculate time equal to volume divided by rate. If you want to calculate volume, you can use the formula rate into time. Hope you all got an idea regarding basics of drug calculation in nursing. If you like the video, please like, share and subscribe. And please press the bell icon for notifications for new videos and encourage me. Comment for more topics if you expect any of the topics from me. So thanks for watching and bye.